So Emma, tell us about this new genetic testing trend.
Okay, so most of us at some stage have realized that when it comes to diet and lifestyle advice, one size does not fit all. In other words, a diet that worked wonders for a friend isn't necessarily doing the same for you. Now, studies have proven that your genes actually determine the level of impact that your diet and lifestyle choices have on not only weight management, but also your health and disease risks. So with the knowledge of your DNA, we can actually personalize a meal plan for you and give you lifestyle and supplementational advice based on your genetic priority areas.
Okay. And for example, if I have family history of diabetes or cancer or something like that, is this test going to tell me then if I'm going to get it?
Not exactly. So we get different types of genetic tests. One being finding out who your ancestors were based on your genes. Another test looking at genetic mutations, which detect cases of cancer and things like Down syndrome. In this case, unfortunately, diet and lifestyle cannot change these specific mutations. And then the genetic testing that we're talking about is genetic variance testing. So this can determine your risk of things like obesity or other chronic diseases like diabetes, heart disease, cancer, even osteoporosis. But luckily, in this case, your diet and lifestyle can actually alter your risk for these certain diseases. In other words, your genes load the gun and your lifestyle and diet pulls the trigger.
Okay. So in terms of disease prevention and weight management, which tests should I be going for then?
Okay, so in this case, definitely the genetic variance testing. But yeah, it purely depends on what your nutrition and health goals are when choosing the specific genetic tests. Meaning, is obesity and weight management a concern for you? Do you have a family history of the diseases that I mentioned? Or do you want to know what supplementation or even chronic medication will actually be effective for you?
Yeah, and where can I get these tests done then?
I would recommend that you get these tests done with a registered dietitian or practitioner who can actually interpret your complex genetic results. And when it comes to health, your genes only form part of the puzzle. So it's important for you to get a holistic picture when managing and treating certain health and disease issues. Yeah, in summary, your genes do determine what you can and cannot eat.
Thank you so much.